Phlebotomy Certification Exam Blood Collection Practice Test. Question 1. Before assembling equipment for a CBC draw, which item should be checked in the preoperative testing area during a structured exam prep drill? Option A. Only the color of the chair. Option B. The patient's favorite beverage. Option C. Tube type, expiration date, needle safety device, and requisition requirements. Option D. The brand of wall clock in the room. The correct answer is option C. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Question 2. To protect patient safety, which sequence is safest after blood has entered the final tube in the oncology infusion center during a clinical simulation? Option A. Withdraw needle with tourniquet tight and no gauze ready. Option B. Activate safety device before removing the needle from the arm. Option C. Remove the needle and recap it before pressure. Option D. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The correct answer is option D. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharps injury risk. Question 3. After reviewing the order, which action should occur before leaving the patient after venipuncture in the dialysis adjacent clinic during a review? Option A. Confirm bleeding has stopped and provide appropriate post-draw instructions. Option B. Leave while blood is still oozing. Option C. Tell the patient to remove the bandage immediately. Option D. Dispose of sharps after walking to another room. The correct answer is option A. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Question 4. Why is patient positioning important before venipuncture in the student skills lab during a mock exam? Option A. It makes labeling unnecessary. Option B. It reduces the risk of falls or injury if the patient becomes dizzy. Option C. It changes EDTA into citrate. Option D. It allows the needle to be reused safely. The correct answer is option B. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Proper positioning does not replace specimen labeling. Body position does not change tube additives. Needles are single-use and cannot be reused. Question 5. In a routine phlebotomy scenario, which patient instruction is appropriate after a routine venipuncture in the occupational health clinic during a skills check? Option A. Scratch the site if it feels itchy. Option B. Remove the bandage while still bleeding. Option C. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Option D. Bend the elbow tightly for 10 minutes. The correct answer is option C. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Scratching can disrupt the site and introduce contamination. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Question 6. Before proceeding with the draw, which action helps prevent backflow from a tube into the patient's vein? Option A. Hold tubes above the puncture site. Option B. Remove the stopper during collection. Option C. Invert the patient's arm above the head. Option D. Keep the patient's arm in a downward position and tubes below the puncture site when possible. The correct answer is option D. Keep the patient's arm in a downward position and tubes below the puncture site when possible. Keeping tubes below the site helps prevent tube contents from flowing back toward the patient. Holding tubes above the site can increase backflow risk. Removing the stopper increases exposure and disrupts the closed system. Raising the arm above the head is unsafe and unnecessary. Question 7. During a scenario, which steps should happen before selecting a venipuncture site? Option A. Review the order, identify the patient, and assess restrictions such as IVs or fistulas. Option B. Insert the needle to see which vein works. Option C. Label tubes from memory. Option D. Ask the patient to choose any tube color. The correct answer is option A. Review the order, identify the patient, and assess restrictions such as IVs or fistulas. Assessment before site selection prevents wrong patient errors and avoids restricted or unsafe sites. Trying a needle before assessment is unsafe. Labeling from memory is a misidentification risk. Patients do not choose tube color for ordered tests. Question 8. Why should contaminated needles generally not be recapped after venipuncture in the hospital unit during morning rounds during a competency review? Option A. It causes all specimens to hemolyze. Option B. Recapping creates a preventable sharps injury risk. Option C. It changes the additive in the tube. Option D. It makes the tourniquet too tight. The correct answer is option B. Recapping creates a preventable sharps injury risk. Recapping requires bringing the hand back toward the contaminated sharp, which increases needle stick risk. Hemolysis is affected by collection and handling factors, not by recapping alone. Tube additives are not changed by whether a needle is recapped. Tourniquet tightness is unrelated to needle recapping. Question 9. When a sharps container is near the fill line in the urgent care laboratory, which action is safest in the urgent care laboratory during a final review? Option A. Push the contents down to make space. Option B. Place extra needles in a biohazard bag. Option C. Replace or close it according to facility policy before it becomes overfilled. Option D. Continue using it until the lid will not close. The correct answer is option C. Replace or close it according to facility policy before it becomes overfilled. Sharps containers must not be overfilled because protruding sharps can cause injury. Pushing contents down places hands near contaminated sharps. Biohazard bags do not provide puncture protection for needles. Waiting until the lid fails creates an avoidable exposure hazard. Question 10. To protect patient safety, which item is an engineering control used to reduce bloodborne pathogen exposure in the pediatric clinic during a study session? Option A. A reminder poster only. Option B. A handwritten exposure note. Option C. A longer tourniquet. Option D. A safety engineered needle with a protective device. The correct answer is option D. A safety engineered needle with a protective device. Engineering controls isolate or remove the hazard through device design, such as safety needles. A poster may educate staff but does not physically control the sharp. A note documents information but does not prevent exposure. Tourniquet length does not protect against needle stick injuries. Question 11. During a blood spill cleanup, which approach is most appropriate in the long-term care unit during a structured exam prep drill? Option A. Wear proper PPE and use an approved disinfectant according to policy. Option B. Wipe the spill with dry paper towels only. Option C. Ask a patient to avoid the area and leave it. Option D. Use bare hands if the spill is small. The correct answer is option A. Wear proper PPE and use an approved disinfectant according to policy. Blood spills require PPE and proper disinfection because blood may contain infectious material. Dry towels alone do not disinfect contaminated surfaces. Leaving the spill exposes others to contamination. Bare hands create direct exposure risk even with small spills. Question 12. When preparing for collection, which resource should be checked for safe handling information about a chemical disinfectant in the mobile collection site during a clinical simulation? Option A. The patient's wristband. Option B. The safety data sheet. Option C. The order of draw chart. Option D. The tube expiration label only. The correct answer is option B. The safety data sheet. A safety data sheet explains chemical hazards, PPE, storage, and spill response. A wristband identifies the patient but gives no chemical safety guidance. An order of draw chart does not address disinfectant hazards. A tube label may show expiration but not chemical handling instructions. Question 13. In a routine phlebotomy scenario, which vein is usually preferred for routine venipuncture in an adult antecubital area in the emergency department bay during a review? Option A. Basilic vein is the first choice. Option B. Femoral artery. Option C. Median cubital vein. Option D. Vein on the underside of the wrist. The correct answer is option C. Median cubital vein. The median cubital vein is commonly preferred because it is usually well anchored and less likely to roll. The basilic vein is closer to nerves and arteries and is usually not the first choice. The femoral artery is not a routine venipuncture site for phlebotomists. The underside of the wrist has higher risk for nerve or tendon injury. Question 14. How should the needle bevel generally be positioned when entering a vein in the physician office lab during a mock exam? Option A. Bevel down at a steep angle. Option B. Sideways with the tube already removed. Option C. Flat against the skin without entering. Option D. Bevel up at an appropriate shallow angle. The correct answer is option D. Bevel up at an appropriate shallow angle. A bevel-up approach helps the needle enter the vein smoothly and supports blood flow into the collection system. A bevel-down steep approach can increase discomfort and may pass through the vein. A sideways needle position is unstable and not standard technique. A needle flat against the skin will not properly access the vein. Question 15. At what angle is a routine venipuncture needle commonly inserted in the community health screening event during a skills check? Option A. About 15 to 30 degrees. Option B. About 5 degrees for every adult. Option C. About 60 to 90 degrees. Option D. Parallel under the skin for several inches. The correct answer is option A. About 15 to 30 degrees. A 15 to 30 degree angle is commonly used to enter the vein without going too deep. A very shallow angle may fail to enter the vein or may drag under the skin. A 60 to 90 degree angle is more likely to puncture through the vein. Advancing parallel for several inches increases tissue trauma and is not standard venipuncture. Question 16. Before inserting the needle for a CBC, why should the selected vein be anchored in the preoperative testing area during a practice drill? Option A. It sterilizes the skin. Option B. Anchoring stabilizes the vein and reduces rolling during entry. Option C. It replaces the need to cleanse the site. Option D. It allows the tourniquet to stay on longer. The correct answer is option B. Anchoring stabilizes the vein and reduces rolling during entry. Anchoring stretches the skin and helps keep the vein steady as the needle enters. Anchoring does not sterilize skin or remove microorganisms. Skin cleansing is still required before puncture. Anchoring does not justify prolonged tourniquet time. Question 17. After cleansing a venipuncture site with alcohol, when should the needle be inserted in the oncology infusion center during a scenario? Option A. Immediately while the alcohol is wet. Option B. After blowing on the site. Option C. After the site air dries completely. Option D. After wiping the area with a used gauze pad. The correct answer is option C. After the site air dries completely. Allowing alcohol to air dry improves antisepsis and reduces stinging and hemolysis risk. Puncturing through wet alcohol can sting and may affect specimen quality. Blowing on the site contaminates the cleaned area. Used gauze can reintroduce microorganisms to the puncture site. Question 18. How long should a tourniquet generally remain in place before it risks hemoconcentration in the dialysis adjacent clinic during a competency review? Option A. At least 5 minutes for every draw. Option B. Until all labels are printed. Option C. Only after the patient pumps the fist repeatedly. Option D. No longer than about 1 minute. The correct answer is option D. No longer than about 1 minute. Tourniquet application beyond about 1 minute can concentrate blood components and alter some results. 5 minutes is excessive and can distort laboratory values. Administrative delays do not justify prolonged tourniquet use. Repeated fist pumping can also contribute to hemoconcentration. Question 19. When should the tourniquet be released during routine tube collection in the student skills lab during a final review? Option A. As soon as blood flow is established and before removing the needle, following policy. Option B. Only after the patient leaves. Option C. Before the needle ever enters the skin in every case. Option D. After 5 minutes to improve the specimen. The correct answer is option A. As soon as blood flow is established and before removing the needle, following policy. Releasing the tourniquet once blood flow is established helps reduce hemoconcentration and patient discomfort. Leaving it on until the patient leaves is unsafe and unnecessary. Removing it before needle entry in every case may make vein access difficult. Prolonged application does not improve specimen quality. Question 20. Why should patients avoid repeatedly pumping the fist during venipuncture in the occupational health clinic during a study session? Option A. It sterilizes the collection site. Option B. It may alter analytes such as potassium through hemoconcentration and muscle activity. Option C. It prevents all hematomas. Option D. It guarantees faster clotting in citrate tubes. The correct answer is option B. It may alter analytes such as potassium through hemoconcentration and muscle activity. Repeated fist pumping can change blood composition and affect certain test results. Fist pumping has no antiseptic effect on the skin. Hematoma prevention depends on technique and post-draw pressure, not fist pumping. Citrate tubes are anticoagulated and do not rely on patient fist motion. Question 21. In a routine phlebotomy scenario, which needle gauge is commonly used for routine adult venipuncture with evacuated tubes in the blood collection station during a structured exam prep drill? Option A 12 gauge needle. Option B 30 gauge needle for all adults. Option C 21 or 22 gauge needle. Option D. A lancet designed for heel stick only. The correct answer is option C. 21 or 22 gauge needle. A 21 or 22 gauge needle usually provides adequate flow while limiting trauma for routine adult veins. A 12 gauge needle is unnecessarily large and traumatic for routine phlebotomy. A 30 gauge needle is too small for standard evacuated tube collection and may slow flow. A heel stick lancet is not used for routine venipuncture. Question 22. For a patient with a small fragile hand vein, which device may improve control in the outpatient clinic during a clinical simulation? Option A large bore blood donation needle. Option B heel puncture lancet. Option C unprotected straight needle used without a holder. Option D winged infusion set with appropriate tube or syringe technique. The correct answer is option D. Winged infusion set with appropriate tube or syringe technique. A winged infusion set offers better control for small or fragile veins when used according to policy. A large bore donation needle is excessive and can injure a small vein. A heel puncture lancet is for dermal puncture, not accessing a hand vein. Using an unprotected straight needle without a holder is unsafe and not standard practice. Question 23. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first in the hospital unit during morning rounds during a review? Option A. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Option B. The discard tube warms the patient's arm. Option C. The discard tube removes EDTA carryover from the skin. Option D. The discard tube replaces patient identification. The correct answer is option A. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. A discard tube is not used to warm the arm. EDTA carryover is managed by order of draw, not by removing it from the skin. No tube can replace proper patient identification. Question 24. If no blood enters the tube after needle insertion, which action is safest first in the urgent care laboratory during a mock exam? Option A. Probe deeply until blood appears. Option B. Gently adjust needle position while staying within policy and patient comfort limits. Option C. Turn the needle in circles under the skin. Option D. Leave the needle in place while searching for another vein. The correct answer is option B. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. Deep probing increases pain, hematoma risk, and nerve injury risk. Rotating the needle under the skin is traumatic and not appropriate. A needle should not be left in one site while searching elsewhere. Question 25. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do in the pediatric clinic during a skills check? Option A. Advance deeper to pass the nerve. Option B. Ask the patient to ignore it until the tube fills. Option C. Stop the draw, remove the needle safely, and follow facility procedure. Option D. Release pressure only after all tubes are collected. The correct answer is option C. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Advancing deeper can worsen nerve injury. Ignoring the symptom places the patient at unnecessary risk. Continuing tube collection delays the response to a possible complication. Question 26. During a difficult draw, why should excessive probing be avoided in the long-term care unit during a practice drill? Option A. It improves all specimen results. Option B. It sterilizes the vein. Option C. It prevents the need for patient identification. Option D. It increases pain, hematoma risk, and possible nerve or tissue injury. The correct answer is option D. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Probing does not improve laboratory accuracy. Needle movement has no sterilizing effect. Patient identification is always required regardless of draw difficulty. Question 27. If a vein collapses during evacuated tube collection, which change may help on a redraw in the mobile collection site during a scenario? Option A. Use a smaller tube, syringe, or winged set according to policy. Option B. Use a stronger vacuum tube on the same fragile vein. Option C. Keep the tourniquet on for several minutes. Option D. Tell the patient to pump the fist continuously. The correct answer is option A. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. A stronger vacuum can worsen collapse. Prolonged tourniquet time can alter results and increase discomfort. Continuous fist pumping may affect analytes and does not solve vein collapse. Question 28. When preparing for collection, which site should generally be avoided unless specifically approved by policy or provider order in the emergency department bay during a competency review? Option A. A well-palpated median cubital vein. Option B. A foot or ankle vein. Option C. An acceptable dorsal hand vein. Option D. A suitable cephalic vein. The correct answer is option B. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. The median cubital vein is a common routine site when suitable. A dorsal hand vein may be acceptable when antecubital veins are unavailable. The cephalic vein can be appropriate when assessed carefully. Question 29. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture in the physician office lab during a final review? Option A. The blood in that arm has no cells. Option B. All tubes drawn from that arm turn blue. Option C. The fistula must be protected from injury, infection, and altered blood flow. Option D. It eliminates the need for a tourniquet. The correct answer is option C. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Blood in the arm still contains cells. Tube color is determined by the collection container, not the arm. Tourniquet decisions do not remove the risk to a fistula. Question 30. Why is the site of a prior mastectomy often avoided for venipuncture in the community health screening event during a study session? Option A. The veins always contain arterial blood. Option B. The skin cannot be cleaned. Option C. All specimens from that side clot immediately. Option D. Lymphatic changes can increase risk for swelling, infection, or complications. The correct answer is option D. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. Venous blood does not become arterial because of mastectomy history. The issue is not an inability to cleanse skin. Specimens do not automatically clot because of collection side. Question 31. When N4 is running in one arm, which collection choice is usually preferred in the preoperative testing area during a structured exam prep drill? Option A. Use the opposite arm when available and follow facility policy. Option B. Draw above the 4 site while fluid is running. Option C. Collect directly through the 4 tubing without authorization. Option D. Ignore the 4 because additives prevent contamination. The correct answer is option A. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from 4 fluids. Drawing above a running 4 can contaminate or dilute the specimen. Line draws require authorization and specific procedure. Tube additives do not correct 4 fluid contamination. Question 32. In the Oncology Infusion Center, which finding makes a venipuncture site a poor choice? Option A. A vein that is palpable and resilient. Option B. Edema, burns, scarring, or signs of infection at the site. Option C. Clean intact skin over an antecubital vein. Option D. A site that allows safe patient positioning. The correct answer is option B. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. A palpable resilient vein is generally a favorable finding. Clean intact skin supports safe site preparation. Safe positioning is desirable for venipuncture. Question 33. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect in the dialysis adjacent clinic during a review? Option A, proper tube mixing. Option B, successful fasting status. Option C, hematoma formation. Option D, normal clot retraction in the vein. The correct answer is option C, hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Tube mixing happens after collection and does not cause local swelling. Fasting status cannot be determined by puncture site swelling. Clot retraction is a laboratory process, not a normal event around an active needle site. Question 34. If a hematoma starts to develop during venipuncture, which action is appropriate in the student skills lab during a mock exam? Option A, continue filling all ordered tubes. Option B, massage the swollen area vigorously. Option C, ask the patient to bend the elbow tightly. Option D, release the tourniquet, remove the needle, and apply pressure. The correct answer is option D. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Continuing the draw can enlarge the hematoma. Vigorous massage can worsen bruising and tissue injury. Bending the elbow can increase bruising and does not provide focused pressure. Question 35. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the occupational health clinic during a skills check? Option A, stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option B, ask the patient to stand up and walk it off. Option C, leave the needle in while getting more tubes. Option D, give the patient food before removing the needle. The correct answer is option A. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Standing can lead to a fall. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Question 36. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the blood collection station during a practice drill? Option A, skip pressure to avoid bruising. Option B, apply firm pressure longer and verify bleeding has stopped before bandaging. Option C, ask the patient to bend the elbow sharply. Option D, use the same bandage time for every patient without checking. The correct answer is option B. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Skipping pressure increases bleeding risk. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Question 37. In a routine phlebotomy scenario, which action helps prevent a hematoma after removing the needle in the outpatient clinic during a scenario? Option A. Have the patient bend the elbow tightly. Option B, rub the puncture site to spread the blood. Option C, apply clean gauze with firm pressure while the arm remains straight. Option D, remove the needle before releasing the tourniquet every time. The correct answer is option C. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Bending the elbow may increase leakage into tissue. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Question 38. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the hospital unit during morning rounds during a competency review? Option A, proper venous flow. Option B, tube additive carryover. Option C, normal capillary refill. Option D, possible arterial puncture. The correct answer is option D. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Question 39. During a final review, which tube is collected first when blood cultures are ordered with other venipuncture tubes? Option A, blood culture bottles or sterile culture tube. Option B, lavender EDTA tube. Option C, gray fluoride tube. Option D, serum separator tube. The correct answer is option A. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. Question 40. In the standard venipuncture order of draw, which tube usually follows blood cultures in the pediatric clinic during a study session? Option A, lavender EDTA tube. Option B, light blue sodium citrate tube. Option C, gray fluoride tube. Option D, royal blue tube for every test. The correct answer is option B. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. Question 41. For a electrolyte panel collection, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes? Option A, lavender, gray, green, serum, light blue, blood cultures. Option B, gray, lavender, green, serum, light blue, blood cultures. Option C, blood cultures, light blue, serum, green, lavender, gray. Option D, serum, lavender, blood cultures, gray, light blue, green. The correct answer is option C. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Question 42. Why does order of draw matter during evacuated tube collection in the mobile collection site during a clinical simulation? Option A. It makes patient identification optional. Option B. It eliminates the need to mix tubes. Option C. It determines the patient's fasting status. Option D. It helps prevent additive carryover from altering later specimens. The correct answer is option D. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Question 43. During capillary puncture, which specimen type is generally collected first when ordered in the emergency department bay during a review? Option A, blood gas specimen. Option B, serum specimen. Option C, gray top microtube. Option D, non-additive tube after all others. The correct answer is option A. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Question 44. When preparing for collection, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the physician office lab during a mock exam? Option A, serum microtube before EDTA for every draw. Option B, EDTA microtube before other additive and serum microtubes. Option C, gray microtube first even when blood gases are needed. Option D, any order because capillary tubes have no additives. The correct answer is option B, EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time-sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Question 45. In a routine phlebotomy scenario, which tube is most appropriate for a routine CBC in the community health screening event during a skills check? Option A, light blue sodium citrate tube. Option B, gray sodium fluoride tube. Option C, lavender top tube containing EDTA. Option D, red no additive tube. The correct answer is option C, lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Question 46. Before proceeding with the draw, which additive is found in a light blue tube used for patient and APTT testing in the preoperative testing area during a practice drill? Option A, EDTA. Option B, sodium fluoride with potassium oxalate. Option C, lithium heparin. Option D, sodium citrate. The correct answer is option D, sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. Question 47. During a scenario, which tube is commonly selected for many serum chemistry tests when gel separation is desired? Option A, serum separator tube with clot activator and gel. Option B, lavender EDTA tube. Option C, light blue citrate tube. Option D, gray fluoride tube only. The correct answer is option A, serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. Question 48. In the dialysis adjacent clinic, which tube is commonly associated with heparinized plasma chemistry testing? Option A, lavender top tube. Option B, green top tube. Option C, light blue top tube. Option D, pink top tube. The correct answer is option B, green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Question 49. For a blood culture collection, which tube is most commonly used for glucose preservation when testing may be delayed? Option A, plain red tube only. Option B, light blue citrate tube. Option C, gray top tube with sodium fluoride and an anticoagulant. Option D, blood culture bottle. The correct answer is option C. Gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. Question 50. To protect patient safety, which tube is commonly used for blood bank testing such as type and screen in the occupational health clinic during a study session? Option A, gray top fluoride tube. Option B, light blue citrate tube. Option C, green heparin tube for every blood bank test. Option D, pink top EDTA tube. The correct answer is option D. Pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Question 51. After reviewing the order, which tube is generally collected for a blood culture specimen in the blood collection station during a structured exam prep drill? Option A, sterile blood culture bottle or SBS containing culture tube according to policy. Option B, lavender EDTA tube only. Option C, gray fluoride tube. Option D, SST after clotting. The correct answer is option A. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. Question 52. Why must a light blue citrate tube be filled to the proper level in the outpatient clinic during a clinical simulation? Option A. The tube color changes if underfilled. Option B. The blood to anticoagulant ratio must be correct for coagulation results. Option C, EDTA needs extra room to mix. Option D, serum cannot clot unless the tube is full. The correct answer is option B. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Question 53. After collecting an additive tube, how should it usually be mixed in the hospital unit during morning rounds during a review? Option A, shake it hard until bubbles appear. Option B, leave it unmixed until centrifugation. Option C, gently invert the tube the recommended number of times. Option D, open the stopper and stir with a wooden applicator. The correct answer is option C. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Question 54. Before proceeding with the draw, which problem can occur if a lavender EDTA tube is not mixed soon after filling in the urgent care laboratory during a mock exam? Option A. The tube becomes sterile for culture. Option B. The specimen turns into serum. Option C. The sodium citrate ratio improves. Option D, microclots may form and make hematology results unreliable. The correct answer is option D. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Question 55. During a skills check, which practice helps reduce hemolysis during a routine hemoglobin A1C collection? Option A. Use appropriate needle size and gently invert tubes instead of shaking them. Option B. Force blood rapidly through a small needle. Option C. Shake additive tubes vigorously. Option D. Pull back a syringe plunger as hard as possible. The correct answer is option A. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Question 56. In the long-term care unit, which laboratory result is especially affected by hemolysis because red cells release intracellular contents? Option A. Patient date of birth becomes invalid. Option B. Potassium may be falsely increased. Option C. Tube expiration date is extended. Option D. Tourniquet pressure becomes lower. The correct answer is option B. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Question 57. When using a syringe for blood transfer, which method best protects specimen quality in the mobile collection site during a scenario? Option A. Remove the tube stopper and push blood in forcefully. Option B. Squirt blood through the needle into each tube. Option C. Use a safety transfer device and allow blood to flow gently into tubes. Option D. Shake each tube hard to remove clots. The correct answer is option C. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Question 58. Why should alcohol be allowed to dry before puncture in the emergency department bay during a competency review? Option A. Dry alcohol makes the tube additive stronger. Option B. Wet alcohol improves vein anchoring. Option C. Alcohol drying replaces tourniquet use. Option D. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. The correct answer is option D. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Question 59. After reviewing the order, which specimen often requires protection from light after collection? Option A. Bilirubin specimen. Option B. CBC specimen for platelet count. Option C. Routine sodium citrate coagulation tube. Option D. Blood culture bottle during incubation. The correct answer is option A. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. Question 60. When preparing for collection, which specimen commonly requires rapid transport on ice or chilled handling according to policy? Option A. Routine CBC kept for the next day. Option B. Ammonia specimen. Option C. Serum separator tube for a lipid panel after clotting only. Option D. Blood culture bottle placed in the freezer. The correct answer is option B. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. Question 61. In a routine phlebotomy scenario, which action best maintains specimen integrity during transport to the laboratory? Option A. Store every specimen at room temperature overnight. Option B. Centrifuge every tube immediately regardless of type. Option C. Follow required time, temperature, light, and handling instructions for the ordered test. Option D. Place all blood specimens in direct sunlight. The correct answer is option C. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Question 62. If a specimen must be transported cold, which approach is appropriate in the Oncology Infusion Center during a clinical simulation? Option A. Submerge the tube in loose ice water. Option B. Hold it in a bare hand to keep it visible. Option C. Place it near a heater until pickup. Option D. Place the specimen in the approved cooling method without direct water contamination. The correct answer is option D. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Question 63. During a review, which situation is a common reason for specimen rejection? Option A. Wrong tube type or insufficient specimen volume. Option B. Collector wore gloves. Option C. Patient stated date of birth. Option D. Tube was labeled at the bedside. The correct answer is option A. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Question 64. Why should tube expiration dates be checked before collection in the student skills lab during a mock exam? Option A. Expired tubes identify patients faster. Option B. Expired tubes may have inadequate vacuum or unreliable additive performance. Option C. Expired tubes prevent hemolysis in every case. Option D. Expired tubes are required for coagulation testing. The correct answer is option B. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Question 65. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the occupational health clinic during a skills check? Option A. Draw the specimen and write fasting on the label. Option B. Tell the patient not to mention the meal. Option C. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Option D. Cancel every test without notifying anyone. The correct answer is option C. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Question 66. Why is fasting status important before some chemistry tests in the blood collection station during a practice drill? Option A. Food changes the patient's legal name. Option B. Fasting makes needles sterile. Option C. Fasting eliminates the need for tube mixing. Option D. Food intake can alter analytes such as glucose or lipids. The correct answer is option D. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Question 67. For a medication trough level, when is the specimen usually collected in the outpatient clinic during a scenario? Option A. Immediately before the next scheduled dose. Option B. Immediately after the medication is swallowed. Option C. At any random time during the day. Option D. Only after the medication is discontinued for a week. The correct answer is option A. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Question 68. During a glucose tolerance test, why must collection times be followed carefully in the hospital unit during morning rounds during a competency review? Option A. Any time is acceptable if the tubes are gray. Option B. Timed results show how the body responds to a measured glucose dose. Option C. Timing only matters after the last tube. Option D. The patient should eat between timed draws to stay comfortable. The correct answer is option B. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Question 69. In a routine phlebotomy scenario, which documentation is especially important for a timed specimen? Option A. The phlebotomist's favorite tube brand. Option B. Only the patient's room number. Option C. Exact collection time recorded on the label or requisition according to policy. Option D. A note saying collected sometime today. The correct answer is option C. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Question 70. Before collecting blood cultures, why is careful skin antisepsis critical in the pediatric clinic during a study session? Option A. It makes EDTA tubes clot faster. Option B. It eliminates the need for sterile bottles. Option C. It changes venous blood into arterial blood. Option D. It reduces contamination that could cause a false positive culture. The correct answer is option D. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. Question 71. When collecting blood cultures with other tubes, which priority is most important in the long-term care unit during a structured exam prep drill? Option A. Maintain sterility and collect cultures before non-sterile tubes. Option B. Collect cultures after gray tubes. Option C. Touch the bottle tops after cleaning to confirm dryness. Option D. Use a non-sterile transfer cup. The correct answer is option A. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Question 72. If using a winged set for blood cultures, why is bottle order guided by facility policy in the mobile collection site during a clinical simulation? Option A. The order determines the patient's identity. Option B. Air in the tubing can affect which bottle should be filled first. Option C. The order prevents the need to clean the site. Option D. The order makes the needle reusable. The correct answer is option B. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Question 73. For a legal blood alcohol collection, which requirement is especially important in the emergency department bay during a review? Option A. Use alcohol swabs for every blood alcohol specimen. Option B. Leave the specimen unlabeled until court. Option C. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Option D. Let the patient carry the open tube to the lab. The correct answer is option C. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Question 74. To protect patient safety, which action best supports chain of custody for a drug screen specimen? Option A. Use only verbal handoff with no signatures. Option B. Store the specimen in an unlocked public area. Option C. Discard the seal after collection. Option D. Document each person who handles the specimen from collection to transfer. The correct answer is option D. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Question 75. Why are tamper-evident seals used on forensic or workplace testing specimens in the community health screening event during a skills check? Option A. They help show whether the specimen was opened or altered after collection. Option B. They replace patient consent. Option C. They make refrigeration unnecessary for all tests. Option D. They prevent the need for a requisition. The correct answer is option A. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. Question 76. For an infant heel stick, which area is safest for puncture in the preoperative testing area during a practice drill? Option A. Posterior curvature of the heel. Option B. Medial or lateral plantar surface of the heel. Option C. Center of the arch. Option D. Tip of the great toe. The correct answer is option B. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. Question 77. Why should an infant heel puncture not be too deep in the oncology infusion center during a scenario? Option A. A deeper puncture always prevents hemolysis. Option B. Depth determines the tube color. Option C. Excessive depth can injure bone or deeper tissue. Option D. A deep puncture replaces the need for warming. The correct answer is option C. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Question 78. Before proceeding with the draw, which finger is generally preferred for adult capillary puncture? Option A. Thumb pad for every test. Option B. Index fingertip in all adults. Option C. Little finger near the bone. Option D. Middle or ring finger on the palmar surface near the side of the fingertip. The correct answer is option D. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. Question 79. After a finger puncture, why is the first drop of blood commonly wiped away in the student skills lab during a final review? Option A. It may contain tissue fluid or contaminants that can affect the specimen. Option B. It contains only white blood cells. Option C. It proves the patient is fasting. Option D. It activates the tube vacuum. The correct answer is option A. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. Question 80. How can warming a capillary puncture site help collection in the occupational health clinic during a study session? Option A. It sterilizes the skin completely. Option B. It increases local blood flow when used safely. Option C. It removes the need to identify the patient. Option D. It makes every specimen suitable for culture. The correct answer is option B. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Warming does not sterilize skin. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Question 81. Why should excessive squeezing or milking be avoided during capillary collection in the blood collection station during a structured exam prep drill? Option A. It improves all glucose results. Option B. It makes EDTA unnecessary. Option C. It can dilute the specimen with tissue fluid and cause hemolysis. Option D. It prevents clotting in serum tubes. The correct answer is option C. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Question 82. When is dermal puncture commonly preferred over venipuncture in the outpatient clinic during a clinical simulation? Option A. For every blood culture set. Option B. For all coagulation studies regardless of policy. Option C. Whenever patient identification is incomplete. Option D. For some infants, small volume tests, or patients with difficult veins when appropriate. The correct answer is option D. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Question 83. A child begins to pull away during a draw. Which action supports safety in the hospital unit during morning rounds during a review? Option A. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Option B. Continue while the arm is moving. Option C. Scold the child until they stop. Option D. Ask another child to hold the arm. The correct answer is option A. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Question 84. When preparing for collection, which explanation is best for a young child before a fingerstick? Option A. Tell the child nothing will happen. Option B. Use simple honest words such as a quick pinch and explain what they can do to help. Option C. Use detailed adult medical terminology. Option D. Promise a toy only if they do not cry. The correct answer is option B. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Question 85. For an older adult with fragile veins, which technique is most appropriate in the pediatric clinic during a skills check? Option A. Slap the site hard to make veins appear. Option B. Use the largest needle available. Option C. Use gentle anchoring and consider a smaller needle or controlled collection device. Option D. Leave the tourniquet on for several minutes. The correct answer is option C. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Question 86. Why should adhesive bandages be used carefully on some older adults in the long-term care unit during a practice drill? Option A. Adhesive changes the blood type. Option B. Older adults never need pressure after draws. Option C. Bandages prevent all anticoagulant bleeding. Option D. Fragile skin can tear when adhesive is removed. The correct answer is option D. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Question 87. During a scenario, which laboratory department commonly performs CBC testing in the mobile collection site during a scenario? Option A. Hematology. Option B. Microbiology only. Option C. Blood bank only. Option D. Histology only. The correct answer is option A. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Microbiology focuses on organisms and cultures. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Question 88. In the emergency department bay, which department usually performs patient and APTT coagulation testing? Option A, urinalysis only. Option B, coagulation or hematology coagulation section. Option C, microbiology culture bench only. Option D, cytology screening only. The correct answer is option B, coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Urinalysis focuses on urine specimens. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Question 89. For ammonia collection, which department is most associated with blood cultures? Option A, blood bank compatibility only. Option B, histology tissue processing. Option C, microbiology. Option D, chemistry electrolyte analysis only. The correct answer is option C, microbiology. Microbiology processes cultures to detect and identify microorganisms. Blood bank testing focuses on transfusion compatibility. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Question 90. To protect patient safety, which department commonly performs type and screen testing in the community health screening event during a study session? Option A, microbiology only. Option B, chemistry only. Option C, parasitology stool testing only. Option D, blood bank or transfusion services. The correct answer is option D, blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Microbiology focuses on infectious organisms. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Question 91. After reviewing the order, which department commonly analyzes electrolytes such as sodium and potassium in the preoperative testing area during a structured exam prep drill? Option A, chemistry. Option B, histology. Option C, blood bank compatibility bench. Option D, cytogenetics only. The correct answer is option A, chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Histology focuses on tissues. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Question 92. When preparing for collection, which practice is part of phlebotomy quality assurance in the Oncology Infusion Center during a clinical simulation? Option A, ignoring mislabeled specimens if the patient is well known. Option B, tracking specimen errors and using corrective action to prevent recurrence. Option C, changing tube labels after results are reported. Option D, skipping competency checks for experienced staff. The correct answer is option B, tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Familiarity with a patient does not make a mislabeled specimen acceptable. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Question 93. Why are competency assessments important for phlebotomists in the dialysis-adjacent clinic during a review? Option A. They replace all written procedures. Option B. They allow staff to ignore order of draw. Option C. They verify that staff can perform required skills safely and consistently. Option D. They are only for patients who complain. The correct answer is option C. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Written procedures are still needed as standards for practice. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Question 94. Before proceeding with the draw, which error should be reported through the facility's quality process in the student skills lab during a mock exam? Option A. A patient correctly states their date of birth. Option B. A tube is mixed according to instructions. Option C. A needle safety device is activated after use. Option D. A specimen collected in the wrong tube type. The correct answer is option D. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Correct identity confirmation is expected practice, not an error. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Question 95. During a skills check, which activity is commonly associated with CLIA waived point-of-care testing in the occupational health clinic during a skills check? Option A. Following manufacturer instructions and documenting quality control for a simple approved test. Option B. Changing the test procedure to save time. Option C. Reporting results without controls when controls are required. Option D. Using expired test strips because they look normal. The correct answer is option A. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Modifying the procedure can invalidate the test category and results. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Question 96. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the blood collection station during a practice drill? Option A. Use a strip from an unlabeled loose container. Option B. Confirm test strip expiration and run required quality control according to policy. Option C. Skip patient identification because the device stores results. Option D. Apply disinfectant and test before the site dries. The correct answer is option B. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Loose unlabeled strips may be expired or contaminated. Device storage does not replace identifying the patient. Testing before the site dries can contaminate or dilute the sample. Question 97. Why must abnormal point-of-care results be handled according to facility policy in the outpatient clinic during a scenario? Option A. Abnormal results should always be erased. Option B. Only normal results belong in the medical record. Option C. Critical or unexpected results may require confirmation, documentation, or immediate notification. Option D. The patient should interpret the result without staff involvement. The correct answer is option C. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Erasing abnormal results hides clinically important information. Both normal and abnormal results may require documentation. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Question 98. To protect patient safety, which blood component is primarily responsible for carrying oxygen? Option A. Sodium citrate in plasma. Option B. Platelet granules only. Option C. Tube separation gel. Option D. Hemoglobin inside red blood cells. The correct answer is option D. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Sodium citrate is a tube additive, not an oxygen carrier. Platelets help hemostasis but do not primarily transport oxygen. Separation gel is part of a tube system, not a blood component. Question 99. After reviewing the order, which blood component is most directly involved in forming the initial platelet plug? Option A, platelets. Option B, albumin only. Option C, glucose molecules. Option D, chloride ions. The correct answer is option A. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Glucose is an energy source, not a clotting cell fragment. Chloride is an electrolyte and does not form platelet plugs. Question 100. When preparing for collection, which vessel type is normally used for routine venipuncture? Option A, artery. Option B, vein. Option C, lymphatic duct. Option D, tendon sheath. The correct answer is option B. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. Arterial puncture is a different procedure and not routine venipuncture. Lymphatic ducts do not provide venous blood specimens. A tendon sheath is not a blood vessel and must be avoided.